abdominal scar mobilization techniques, come into a comfortable position, either lying all the way down on the back or semi-reclined with the knees bent to take some slack off the hip flexors and relax the belly muscles completely. You'll begin by taking both hands above the abdominal scar and using only enough pressure to just feel sensation on the skin, and you'll just start to investigate the sensation, moving the fingers up and down and side to side, above the scar and then below the scar, beside the scar, and then as you can tolerate on top of the scar. When you begin, you'll use only about as much pressure as you would use to spread lotion on the skin, so you're really looking for the most superficial, the top layer, and just to start to experience what it feels like to touch that skin. If at any time it becomes too much to tolerate, the sensation isn't something that is particularly pleasant, it evokes difficult emotions regarding your birth experience, feel free to stop, take a break. Mobilization techniques are only intended to be done for about 5 to 15 minutes a day, and even that is working within your tolerance. When you become comfortable with just the sensation of touching the skin, you can move a bit deeper with your pressure. The techniques will be the same, moving the fingers up and down, side to side, generally making circles. And this time you'll move deeply enough to move the skin only. And so you'll begin to just move the skin on the muscle tissue below without an intention of putting pressure in the muscles at all. And you'll move up and down, side to side, circles, and you'll start to notice which directions feel any kind of restriction. So you may find ease going up and down until you come to a certain point and it feels that the skin is adhered down a bit more, which is common after an abdominal incision. And what you might do is just spend about 30 seconds in the area of the restriction. So if you're trying to go up and down or up and you find that the tissue gets stuck, hold for 30 seconds. Work on taking deep breaths, closing the eyes, and see if you notice that some of that tissue might start to release. Feel free to take a break from scar mobilization if you feel that you've had enough after doing just the superficial touch of skin and then moving down into just moving skin on the muscle below. One side note to be aware of when you're working with just the sensory aspect of the skin, just touching the skin, you might work with different textures of material to get the skin a little bit more acclimated to being touched. And so it could be just the light touch of your fingers. Then you might play around with using cloth, a cotton ball, you might roll a tennis ball, and you're not looking for heavy pressure, you're looking for texture and allowing your brain to reintegrate the sensation. Scar tissue tends to have a bit of heightened sensation, and you may even experience some numbness. So the experience of scar tissue is definitely not universal. You want to just pay attention to what you're feeling in your body. Progressing down a bit deeper now into generally what's considered the muscular layer, you apply a little bit more pressure until you can feel the muscle bellies of the abdominal muscles. And then again, you'll go right back to the same technique, starting with vertical pressing up and down. And so by up and down, from head to feet and feet to head, and then working along the scar, you might start to go side to side. And so from your right to your left. And again, stopping when you find any restriction, spending about 30 seconds or so, breathing into what restrictions you feel, becoming curious about how those tissues might be in a way stuck together, which is normal for the body's tissue healing. Our goal with scar mobilization is to release the tissues to allow them to move more freely without being adhered down to one another, without skin adhering to muscle and muscle adhering to surrounding tissues, fascia, and organs, and each organ moving independently. One of the other key points with scar mobilization is that we know that the fiber arrangement in typical healthy tissues is generally accepted as a linear arrangement where the fibers are all in a line with one another. However, when there is tissue disruption, like an incision and a scar, the scar tissue is laid down in a pretty haphazard fashion with the fibers going in all different directions. And it's believed that scar tissue mobilization helps to realign those fibers in a more linear fashion, more similarly resembling healthy tissue. At this point, you've done general sensory work for the skin, worked with moving just the level of the skin on the fascia, fatty tissue, and muscle below. And then moved into the second layer where you're moving beyond the skin into the muscle tissue, feeling any adhesions and any restrictions in the muscle tissue. And then as you lie on your back or semi-reclined on the back with the knees bent, generally exhale the breath and try to relax fully so that the hands may be able to penetrate a little bit more deeply than the muscle. If the muscles are tensed up, it will be difficult to really feel around in there. But you're going to go to a level of depth that would be generally considered below the muscle. It's not intended to be painful. It may be a stronger sensation as you're moving with more depth. And again, just an exploration how the tissues move. So we're not trying to go in and release knots or move organs around. The intention is to use the fingers to assess the way the tissues are moving up and down, side to side, circular motions. And you'll just continue to note what you explore above the incision, below the incision, beside the incision, and then on top of the incision. You may even work with some of the deep hip flexor muscles, the iliacus and the psoas muscle, by finding the two front hip points, commonly known as the ASIS. And those are the two hip points, or the two hip bones that we feel in the front. And taking your fingers and walking them in toward the middle, maybe about an inch or two on either side, and then applying some pressure there and noticing if you find any tenderness in those muscles. And if you look at a representation of a pelvis, the representation of the pelvis, the iliacus muscle lines the inside of the pelvic crests and is generally accepted as a hip flexor, which means it can get pretty tight as the weight of the baby pulls the mom's pelvis forward throughout the 9 months of pregnancy. But in addition to tension and tightness, we can also find some weakness in those muscles. So The mobilization technique to work in there is just generally an exploration and noticing what you might feel. Disclaimer for all techniques: these are generally accepted to be basic home techniques that can be done to help to ease the formation of excessive scar tissue and to help ease the flexibility and mobility of tissues after incisional scars. Always a recommendation to consider a full assessment by a pelvic floor physical therapist. And obviously the techniques offered here in this webinar are generalized and can't take into account any of your specific tissue needs or any of your medical history. So consider getting a full assessment if you have questions or specific concerns. The final technique that we will work with on all levels is generally accepted as a pinch and lift type of a technique. And this one can be really tricky at first. So you'll start with tissue that moves generally in a healthy way, the tissue above the incision, maybe the tissue below the incision. And it's a light pinch and a lift of the skin. Like you're just trying to lift and pull the skin away from the tissue below it. And again, you'll work above, below, beside, and on top of your incision. Most people find that the incision is quite difficult to lift. It in fact feels adhered down. And when patients or moms go to pinch and lift the incision, they find that the incision remains behind and the tissue on the side of it kind of lifts up, almost like a hot dog bun. And so the aim is to lift the incision like a hot dog, but oftentimes the incision stays stuck down and the tissues beside it pull up. It's important to be patient and to not pull or tug too aggressively, but just to note that those tissues are adhered down, and move gently and slowly and try to ease the tissues up. There's a little bit of persistence required with the pinch and lift technique. And it's not a hard, aggressive pinch. It shouldn't be painful. You may feel some sensation, but it generally should ease off, and you should become a little bit easier to pinch and to lift. And again, just paying close attention to the breathing and making sure that the belly remains relaxed.